this webinar after. Okay, so it's not recording. Got it. Okay, so, sorry. Welcome to our webinar with Dr. Jen Tang. Dr. Tang is an internist practicing in California, and she's also working with various forms of volunteering. We thank you all for attending this webinar with us. I'm Kang, I'm the project director here at Shadow Bunny, and I'll be hosting this meeting for you. With us, we have a co-director and co-founder of Shadow Bunny, Marissa Syed.
Hello, everyone.
Okay, so today on our schedule, we have a presentation for you, followed by a Q&A session with Dr. Tang. We recommend that you take notes during the presentation so that you can take a quiz afterwards. After each of our webinars, we give students a short 10 to 15-minute quiz. It's super easy, no worries. In order to gain the shadowing hours from Dr. Tang, you will have to not only complete the quiz, but score 70% or above. Once again, it's super simple, so don't stress about it, just pay attention and you'll be fine. Now I'll pass it off to Dr. Tang to introduce herself, and we'll get started with the presentation.
Okay, hey, are you wanting me to come up on the video, or how does that work?
Oh, your camera's already on, so you can just start speaking about the presentation.
Okay, all right, sounds, so, okay. Well, I'll leave the tech stuff to you then, but if you want to feature me on the video so I come up on the side, that's fine. So hi, everybody. My name is Jennifer Tang. I'm so happy to be with you guys here today. As you heard, I am trained in internal medicine, which is general adult medicine, as well as acupuncture. And we can go on to our first slide, please. Okay. I feel awkward not being able to at least see my face. Is that possible?
I'm sorry, right now I am unsure of how to get your camera showing. Everyone else could see your face right now?
Oh, really? Oh, okay. That's fine then. As long as you guys can see me, that's fine. I just feel weird talking to you from a weird non-space, but if you guys can see me, that's great. Okay. I live in, it's funny actually. So I found Shadow Bunny on Instagram and I connected because I thought it would be great to have a chance to mentor some people who are interested in getting into medicine. It turns out a lot of you guys who are putting this together come from the town where I lived in the past previous 10 years, West Windsor. And I actually moved from West Windsor to Southern California, the Los Angeles area, about 3 years ago. So it's been a really fun change for us. We love the weather here. But of course, there's some great things about West Windsor too that we do miss. As the slide says, I have 3 boys. Actually, my little one just turned 10, so they're now 10, 12, and 14. And we adopted them all from Taiwan. A little interesting fact. I do like to stay active. Actually, I stay active. It helps a lot with my mental health. And right now I do kickboxing, rock climbing, a little bit of yoga. We love outdoor activities with the boys. So hiking, biking, swimming. You can tell why I moved to Southern California. So 2 things I want to emphasize on this talk, which, I don't know, maybe you guys have attended other talks and seen other doctors speak. I don't know how much this is emphasized to you, but I want to emphasize to you, number 1, that most of you are very young, I assume, on this talk, so that change is totally okay, and you might think that you want to be a doctor and that might be the right path for you, but maybe there's a different path for you out there. So to me, for our family, a big change was moving across the country, not really knowing many people here. It was kind of scary, but it worked out for the best. So you might feel like you're on a set path, but don't be afraid of change, number one. And number two, I want to emphasize to you, keep an eye on your mental health. I do my regular exercise to specifically help with my mental health. And that is a major problem especially right now during the pandemic for healthcare workers. So if you decide to go into this field or any other field that, I think there's tons of work situations that are stressful. So make sure that you are, keeping an eye on your mental health and doing the things that you need to do to take care of yourself. Okay. Because we don't get trained in that at all in the medicine path. Nobody tells you to take care of yourself. So you just got to do it yourself. Okay. Okay. So let's go on to the next slide. Okay, so funny thing, right? My background is that I'm Chinese American. I was born in New Jersey. When you come from an Asian family, you hear, well, I'm not a stereotype, but I think it's a little bit true that you hear all growing up that you should grow up to be a doctor, right? And so I remember being like 5 years old and talking to my cousins, and my cousins were all like, oh, when I grow up, I'm going to be a doctor. And I was like, well, my parents told me I could be whatever I want, and I was so proud of that. And then we were probably 5, and I was like, well, you don't even know what a doctor is, how do you know you want to be that? And my cousin was like, well, I don't know. I just know, when you're a doctor, you make lots of money. So I'm like, okay, fine. So, I always rebelled because my parents were very open-minded, and I always rebelled against this idea, like, you have to be a doctor. So I was like very proud. My parents said I can be whatever I want to be. Well, come to high school years, I started to read and get really excited about these discoveries, what the human body can do, all these like biological, new breakthroughs. And I got really excited about like the kind of miracle of biology and how the human body just knows how to do its own thing, right? Like heal itself. It's pretty cool. So in my mind, I said I wanted to do research in biology to help make one of those discoveries. So that's what I went into college thinking, and even in college, I heard the same thing from my friends. Oh, Jen, you get good grades. Why don't you just be a doctor? And I was like, no, I don't want to do that. I'm going to, go to a lab and do research and make some awesome discovery. Well, this is another tip for you. Make sure you actually have some experience shadowing or, kind of figuring out, and you guys are doing this from this talk, what it's like to do the career that you think you want to do. Okay, so this is the lesson that I had. I spent a summer doing research. And what I realized, which I probably should have realized before, this was my sophomore year in college, and that it is very like meticulous, and the people who make their careers working in the lab are very tied to the lab. A lot of them don't really make time for socializing. A lot of them just feel like they're married to the lab. They dedicate their lives to it. And I admire those people so much. I mean, without them, we wouldn't have this COVID vaccine, right? But it takes like decades to work hard and maybe make a discovery and maybe not, so I realized, as you can tell, I'm a people person. I love talking to people. Maybe the lab life wasn't right for me. So I had to reevaluate what I thought I wanted to do and come to figure out like, hey, maybe being a doctor is the right thing for me. It fits my personality. I like talking to people. I like educating people. I like learning about how the human body works. Okay, so, but to me, it was very important that it was my choice, not someone else telling me to do it. So I made that decision about sophomore year in college, as you could see on the slide. And then I was like, oh no, now I have to take my MCATs, So, I want you also to kind of focus on what you're passionate about, what you love, not necessarily doing this because someone else tells you it's the right thing for you. Okay. Figure out what your personality is and what matches up to your personality. So like you see on the slide, I am a very empathic and caring person, emotionally sensitive. And I think, that does help me in my career as a doctor, wanting to heal people, wanting to connect with them and make them feel better. As you see here on the slide, I grew up in New Jersey and I had a public school education in Bergen County. I went to Ramsey High School. That's north of where a lot of you guys are. I did undergrad at Cornell and Cornell upstate. Back then, there was not much up there except cows. The internet was barely getting started, so I didn't really know much of what was going on in those 4 years in the outside world, outside of Ithaca, New York. But I did meet my husband up there, so that was very wonderful. And then we came back down to New York City for medical school at Cornell as well. Let's see. And then, my family and my husband's family both grew up in New Jersey. So we decided to go back to New Jersey for my residency training. And I think I'll probably add more to that later, but we can go on to the next slide. Okay, so in terms of extracurriculars, my personal opinion is that I don't think it matters what you do. It matters that people want to see that you're a well-rounded person, so it's not really like check that you have to have all these things on your resume to get into med school or anything. But I think it's just that they want to see that you have a personality outside just studying, and what do you love to do? So I was involved in a lot of volunteer work. We had, I was friends with a lot of, I think, other classmates whose parents were immigrants. We felt connected in a different way, but from all different backgrounds, so international clubs, Model UN, Odyssey of the Mind, those were some of the activities that I did. But like I said, I don't think it specifically matters what you do, as long as you find the things that you do enjoy, that you're passionate about, and show that, you're, besides studying, you can do something else. Okay, so getting into some of the struggles of medicine or of my medical education. When I first, so let's see, I was in public high school, then I went to Cornell undergrad. Cornell undergrad was very hard in terms of the workload, but it wasn't, it was, you had to learn a new way to study. I would say in high school, you were able to finish all the work that's given to you and feel like you can do it well. And from what I've heard from my friends, Cornell, even though it's easier to get into in terms of the Ivy Leagues, it's much of a heavier workload than a lot of the other Ivy Leagues. So, but take this with a grain of salt, because this was like 25 years ago, okay? But I will say that I had to learn a new way to study because we were getting so much information at Cornell undergrad that it was inconceivable for me to really read at all the assignments that I was given. So I had to learn how to prioritize and figure out like what was most important to study. So I think actually that's probably a good skill for life in general, because life is going to throw things at you where you're never going to feel like you have 100% handle on everything. So you do have to learn to prioritize and let the little things fall to the wayside. I know that if you're on this talk, you're probably very ambitious, very hardworking, probably used to being able to do all the things, but life is not really going to be like that. And sometimes it's hard for people with our kind of personalities to accept that you won't be able to do everything. So I guess undergrad prepared me for that. But I will say that I was really in shock when I got to med school. So this was in Manhattan, okay? my Cornell Medical School. So one, I had come from a pretty, you know, like a well-to-do environment, you know, upper middle class, like suburbs. But, you know, nobody in my family was a doctor. My parents were immigrants from Asia. So we didn't have any like fancy connections or anything. A lot of my classmates had connections and, you know, were kind of felt like a little bit entitled because their, you know, father was, for example, an orthopedic surgeon at hospital for special surgery. So that maybe they got that interview because of them or whatever. So I really felt like my med school class was divided in two. Half of us that really worked our butts off to get there and were expecting to work our butts off to continue on, and half that kind of almost, you know, I want to say, like, I don't want to be disrespectful, but in a way I felt like it was handed to them because they came into class almost like not expecting to work hard, like, you know, expecting that it was going to be handed to them as well. Okay, so what happened in my first semester of medical school was very devastating to me. We were assigned to a small group. And in this small group, it was both sets of the people that I described, okay? And we had a group project to work on, and it was like, we had, I think, 48 hours to work on it, and it was a huge assignment. So a lot of people were staying up all night working on this group assignment. Well, we had, I think, took a break for a meal and said we were going to meet back and work on it more. And then when we went to meet back, only half of the group came back. And the other half of the group, we couldn't find them. So we spent like we probably waited for them for like an hour and then went looking for them. And, you know, all this time, meanwhile, the other groups are working and we're kind of just waiting around, like, where did they go? Well, we finally found them. They were hidden in a different conference room. They were purposely hiding from us because they had actually gotten from, I don't know how, but they had gotten some of the answers to the problem that we were assigned. They were basically cheating. And they knew that our half of the group wouldn't be cool with cheating. So rather than just tell us or break from us or whatever, they hid from us. It's like super mature, right? So anyway, I was so upset about this. And I was like, is this what I got myself into? Like, people have to cheat to succeed here? Or if you don't cheat, you get stabbed in the back and you know, like, get abandoned by half of your group, you know? So we were emotionally upset by this and then scrambling to get the assignment done with just half the group. Anyway, it took me a while to kind of recover from that episode, but I found the people in my class that had the same philosophy as I did. I found the right people who were there like, you know what, if we're going to be good doctors, we need to work hard at this. You're not going to be a good doctor if you cheat your way through medical school. And it was sad that it happened. But the reason why I'm telling you this story is that along the way, in any competitive field, and especially in medicine, of course, because it's very competitive, you're going to find people that are just going to try to climb their way to the top in the wrong way. And you need to stay true to yourself, remind yourself of the reason why you're there and what the outcome is. It's not just to get a good grade. It's not just to be at the top of your class, right? Sure, we could have cheated, but like, then at the end of the 4 years, what does that MD mean, right? So it's kind of scary to know that there are doctors out there who cheated their way through school, but this is, to me, a very important message. Don't get lost in the competitiveness of it. You know, stay true to yourself, stay true to the reason why you're there, and be on the right path. Because yeah, maybe they got better grades than I did and they, you know, graduated with their MD too, but I know that mine meant something. Okay. So yeah. Okay. So we can go to the next slide. Okay, so to me, this is about choosing internal medicine, choosing medicine, choosing to be in the medical field at all. Okay. Training to be a doctor is not easy. And nowadays, as I'll get into more in a little bit, being a doctor is also not easy. Do you make a good living? Yes. Sometimes you come out in debt though, and sometimes you're paying back those loans for quite a long time. You do have job stability. I think that that's something, but if it's not something you love, it's a very tough thing to go through. So again, I think it's really important for everyone to make sure that it's really something you're passionate about. Make sure it's really what you want and not someone else telling you that that's what you want. And I think no matter what field you go into, it's very important to find the right people to work with. That can make or break your experience. I remember someone telling me, like, the people you go into practice with are almost like you almost end up spending more time with them than you do with your spouse. That's not necessarily true. Don't make that true, because that would be kind of sad, but it is, like, in a way, a marriage, because you do see them a lot. And if they're a pleasant person, that can be a great work environment. And if they're a very negative and toxic person, that can just make your day miserable. And I think in terms of work-life balance, when I was deciding whether or not to be a doctor, I asked so many people, like, is it going to take over my life? Family is very important to me. I want to have a family. And I think a lot of people were like, oh yeah, it's going to be no problem. But I think you have to make it work for you. You can do it, but it's not easy. And it all depends on your priorities though. And it also depends on what specialty you choose. So you want to maybe, once you're further along your path, shadow specifically the type of specialist that you are interested in and see what their lifestyle is like, see if that matches up with what your vision is for your life. Okay. I'm just double checking my notes to see. Okay, so I wanted to also give you a sense of what medical school and what residency is actually like. Because right now, most of you are coming from the frame point of, like, what high school is like. So the first 2 years of medical school are going to feel similar to college. You are in a lecture. At least this is what it was like when I went through it. It definitely could have changed by now. But when I went through it, the first 2 years were like lecture. The first year you're learning regular human anatomy. You're learning how the body is supposed to work, all the different organ systems. It's pretty cool. I thought it was fascinating because we were just like learning how the body works, which is, I think, so cool. And then the second year, it's a similar setting, but you're learning, like, what happens when things go wrong. You're learning about disease processes, what happens in the body there. Third and fourth years of medical school are shadowing in the hospital or outpatient, but mostly hospital, where I trained in internal medicine. So it's like 1 month you might shadow on the pediatric floor and see children, and 1 month you might shadow in cardiology and see, heart patients, and maybe 1 month you have in clinic or something like that. And then fourth year is similar shadowing, but you have more options in terms of electives, because as you're kind of honing down what fields you want to be in, and then you choose the electives that match up with what your interests are. So in case anyone doesn't know, for medical, you need the 4 years of undergrad, 4 years of medical school. At the end of medical school, you earn your degree, which is usually either a MD for medical doctor or DO for doctor of osteopathy. I find them to be pretty equivalent. Doctor of osteopathy, they learn a little bit more, like manipulations of bone structure and things like that. But I think, having worked with some DO colleagues, it's pretty equivocal. training. So then residency is when you choose what specialty you want to go into. And so actually you can go on to the next slide, because I think that's talking more about why. Yeah. So why did I choose internal medicine? It's interesting. I actually went into medical school thinking I wanted to do pediatrics because I love children. But I found that in pediatrics, there's two tracks, right? There's general pediatrics, which is the pediatrician that you guys probably all go to for your annual checkup. And if you're a regular kid, it's pretty, everything's going fine and it's pretty straightforward and simple, right? Because most kids are not supposed to be sick. So for general pediatrics, I found it to be kind of routine, like not as challenging, right? But then when it came to the sick kids in the hospital, I found that to be too depressing for me personally, like a very emotionally sensitive person. I was like, oh my gosh, these kids are sick. And it was very hard for me. So what I realized is I love educating people and being an adult. So internal medicine means basically the primary care doctor for adults. I do general adult medicine. So if an adult has whatever their medical problem is, I'm the first person that they come to. I like having that relationship with them. I like being like, oh, that, Dr. Tang is my doctor. If I have something I'm worried about, I'm going to call her. That I a lot of times go through the years with them, at this point, I've been practicing for over 17 years now. So I do have some patients that I've gone through the years with. I get to know them. It's nice. There's also a really strong educational component in it, because you want your patient to understand their disease process, to be invested in getting better. Otherwise, they're just like, why am I taking these pills? What is it for? I don't feel different, after taking it, right? So you want them to understand why you're doing what you're doing. So they're also invested in getting healthier. And it's nice, I can take care of a patient who's maybe in their 60s and their kid who's in their 30s. It's nice to be able to also get to know the family across the generations. I, also really fell in love with neurology. The way the brain works is super fascinating. But unfortunately, right now, we don't have a ton of great treatments in terms of getting the brain better. I mean, there are some in certain subspecialties of neurology, but if you're thinking something like, a stroke, for example, once that part of the brain dies, there's physical therapy and things we can do to help with it, but there isn't a ton. And I feel like we need more research and understanding in the brain right now. So clinically, not a ton to do in that area, in my opinion. So for me, when I went through my rotations, say like with the ophthalmologist or something, for example, you look in their eye, you see, oh, like it looks like they have diabetes. Then I want to ask them about their diabetes. I want to ask them about their diet, their sugars. That's the job of a primary care doctor, right? The ophthalmologist doesn't want to get into that. So I realized I just love getting to know people. So primary care, internal medicine was the right place for me. So let me just bounce off from here and tell you a little bit about what my residency was like. So residency is when you choose your specialty. Like I said, I chose internal medicine. There's a match program. I'm sure it's all online now, but basically you rank. It's not the same as like getting into college or getting into med school. It's you rank in order of preference the different programs that you want, and then they rank you. And then there's a day, I think in the spring, I think it's March or something, where they match, and it's like, you find out where you're going. It's not like you have a choice. It's just, you find out. So that to me, when we made that decision, my husband and I wanted to go back to New Jersey to be closer to our families, because ultimately we knew that we wanted to settle down in New Jersey. So yes, I could have stayed at Cornell and had the better name, but I actually, it's funny because a lot of my colleagues did stay at their bigger name New York City programs. And then when they finished, they had a harder time looking for a job where they wanted to settle down in the burbs in New Jersey. But because I did my residency in New Jersey, already got to know a lot of the physicians in the community and got a job offer, right after finishing. So don't necessarily think that just because it's a bigger name that it's a better path for you. You kind of have to just get a sense of what your priorities are and what you want. I also think that my residency choice, which was Rutgers, Robert Wood Johnson in New Jersey, still a great program, but just not as, recognizable as the name Cornell, right? It was very family friendly, because I think a lot of the people who chose that program chose it for the same reason as I did. They wanted to be closer to their families and they wanted to ultimately raise a family. So whereas when I did my med school rotations, people were very much more competitive. In New Jersey, where I did my residency, if a colleague had a wedding to go to, people would be much more willing to say, you know what, I'm going to cover, go have fun, go to that wedding, I'll cover for you, and then you just cover for me on a different day, much more willing to do those things for each other. So again, the environment that you're in, very important, know the type of people that you're going to work with. So what residency is actually like, it is a hard time in your life because it's very time consuming. Minimum of 3 years. That's 3 years that I did for internal medicine. But if you want to subspecialize, it would be more years. Like say you wanted to do cardiology, then you would do extra years of a fellowship in cardiology. So it is rotating through the hospital most of the time, unless you do a strictly outpatient program. Like I think family medicine is mostly out in clinics, but for most of the programs, you're going to be in the hospital. And you take calls. So that means, depending on what your program's like, you might be on call every 4th night or something like that, meaning that like every 4th night you may stay overnight at the hospital and have to answer pages and things like that. And then I know that some programs now have developed night float, which helps you split up the day, like by 12 hours in the morning and 12 hours at the night. So that is easier if if your program has something like that, you don't necessarily have to stay up all night. So I don't, like I said, there's probably been a lot of changes since I went through it, but just keep in mind, it's not at all like a regular lifestyle. You don't get weekends off. You don't necessarily get nights off even. A lot of your friends that age are going to be like, hey, I'm making money now. Let's go out on the weekend and hang out. And you're going to be like, sorry, I'm not making much money. Residency is just like a minimal salary. And I also am working on the nights and on the weekends. So you do have to be sort of willing to let some of the best, the years of your life where you're a young adult is supposed to be the most fun. You're going to be working hard. So again, do it if you love it. If you don't love it, it's going to be a tough ride. But I met some awesome people during residency, and we work hard, we play hard together. Okay, okay, let's go to the next slide. Let's see. Okay, so you know what? I wanted to take the time here before we get into specific misconceptions to tell you the story. I'm just looking at my clock for a second. We're good on time. Okay. To tell you the story of how my career developed, because I think there's a lot of good lessons there. And it's not very straightforward. So like I said, don't be afraid of change. So let's see, I finished my residency. If you go straight through and don't subspecialize like I did, when did I finish? When I was, I think I finished my residency when I was, oh man. All right. Well, I'm going to have you do the math then. You finish undergrad when you're 22, then you finish med school when you're 26, then so it's about residency when you're 29. Okay. So by the time you're done with all that training, you're already 29. I mean, I know to you guys, that probably sounds really old. So I was about 29. And like I said, through my residency, I got to know a lot of the doctors that rotated through the hospitals, and I, also got to shadow some of them in their clinics. So I already had a job offer when I was done with a local private practice. So the first 8 years of my career, I was in private practice, which basically means that I'm a business owner. And it was a great experience because those doctors who were all older than me taught me how to run a medical business. They taught me the ins and outs of that. It was a very different time in medicine when you could sort of control more of the way that you practice. I would say this might be getting ahead, but I'm going to try to tell you, if you want to know, like, the private practice is probably, if you guys decide to go into medicine, it's probably going to be exceedingly rare, except for maybe in more rural areas. I would say the pluses are obviously that you have control over everything. You have control over everything, but the negatives are that, like, you don't get paid time off. You're pretty much, it could be like 24/7 if you make it your own business, which is the case for any business that you own yourself. And let's say, like, as the youngest doctor in that practice, I was IT, every computer question they came to ask me. So, you sometimes don't have the support that you do in like a larger business. But there are some really nice things about private practice that you feel like you can, do it the way that you want to. Also, in private practice, your salary is unpredictable, right? Because it's just based on how many patients you can see and the procedures that you do. And in New Jersey, we had a lot of older patients that would go to Florida for the winters. And then, during the winters, our salaries would drop, and it happens inevitably because half of your patients go to Florida. So that was the first 8 years of my career. And then something that is very relevant to you guys happened, which is that more and more hospitals were buying up small practices like ours. Okay. And this is happening across the country where, like I said, it's very rare nowadays for smaller private practices to stay successful and competitive, because large hospital systems have all these resources and they are buying up smaller doctor private practices. Now, there are still some that are really large physician-owned practices where you might have like a whole, like, we were 4 doctors. You might have maybe 30 doctors pool all their resources together and have something like that that's still viable. But nowadays, most doctors are going to be employed by hospital. And that's where I think the profession gets very tricky. And I want you to be aware of this challenge, okay? Because once you are owned by a hospital and your clinic is owned by a hospital, the hospital administrators are the ones that make the shots, and they're not necessarily doctors. Most of the time, they're not doctors. Most of the time, they're trained more to focus on finances than to focus on patient care. So this is the moment in my career that I found very, very frustrating and very, very difficult. And this is something that if you talk to enough doctors who are being honest with you right now, this is actually a moral crisis that a lot of us are facing now, because these large hospital systems are honestly focused on making money. They're focused on the bottom line. And we as doctors are trained to do what's in the best interests of the patients. So you have pressure coming from both sides. So I went to work for the hospital-owned practice. Okay. I worked in a clinic, but it was owned by a hospital. And what that meant for me was that now they are counting something called RVUs, which is, well, I don't even know what it stands for, but it basically is a productivity number. It's a number of how many patients you've seen, how many procedures you've done, all of those things. Basically, how much money are you making for your company? Okay. And your worth is started as a doctor. You know, my worth was no longer about, hey, am I giving patients the best care? Do the patients like their interaction with me? Are they loyal to me? Are they coming back? It was about that number, the productivity number. And I felt like that was all I was to them. You know, I didn't feel like they really cared about how good of a doctor I was at all. They just cared about how much money I would make for them. So I will tell you that most of the doctors I know are in the middle of this problem right now, that the environment in which they work is pressuring them to make money. They are still trying to do the best they can for the patients. And it is a very, very hard struggle to try to do both. And by the way, your bonus that you earn for your family is oftentimes based on that productivity number, right? So you feel like you're choosing between being a good, you know, provider for your family and being a good doctor for your patients. It is such a difficult position to be in. And that was when I had a little career crisis and decided to start a totally unrelated side business selling skincare online. Okay, I'm not going to get into that too much, but my point is only that it's okay to look outside the box sometimes. And that online business not only helped me make a side income, but helped to open up my eyes that, like, hey, there's other options out there that I can pursue. I don't have to do what I thought I was going to do was finish my training, be a doctor like full-time until 65, retire, and then pursue other interests, you know? And I realized it doesn't have to be like that. So once I started to have that separate income from my online skincare business, I decided to leave my clinic, the hospital-owned clinic, and I became a consultant for a medical tech startup that was based in San Francisco, but they were doing a sort of test of their program in New Jersey. So I did some chart reviews as well as did some home visits in the Trenton area. And a lot of people thought it was kind of crazy for me to go from my nice Princeton, New Jersey hospital-owned office where I got a good salary to going into patients' homes in, you know, down inner city Trenton. But it was a really educational experience. I got to see a whole different side of patients and the factors that go into why they might not be taking their medicines, right? Maybe they can't afford them. Maybe they don't have a car to get them to the pharmacy to pick up their medicines. Maybe they are at home and relying on a family member to get them, right? So all these different factors that I had never thought of. Or why can't they eat healthy? Like maybe they don't have a place nearby that offers, you know, fresh produce, or it's very expensive in the area that they live in. So that's what I was doing before we moved our family out to California. And when we first moved to California, I decided I wanted to wipe the slate clean and just come out here. I came out here with solely my online business and did not know what I was going to do in medicine at all. I wanted to have time to focus on my family first and make sure they got settled in. Very happy that I had that time to make them a priority. And then I found something else that I actually wasn't even aware of, which is a nonprofit clinic. It's federally funded and it serves the underinsured population. So the technical term for this is called a federally qualified health center. And I started working just per diem, which means that I basically would make my own hours and tell them when I'm available. But what I found was that, hey, this is finally a type of setting where nobody's focused on how much money we can make because it's a nonprofit. And everyone who works there has a heart to serve. That's why they're there, you know? And I love my work setting now. So I've actually, after doing the per diem setup for a while, I was able to transition to becoming a regular part-timer, which means I commit 20 hours a week to that clinic. And it's very rewarding work. That population is very grateful for you just doing your job. And I feel like they are, yeah, I feel like it's a great rewarding place to work. And like I said, I only work there 20 hours a week. So I also make time to do my other online business. I'm also getting into like expert witness work and medical legal consulting. Of course, I love my fitness. I love time with my family. So I'm able to sort of design and shape my life to finally come to the place that I want it to be, but I'm 47 years old now, so it took a long time. But I wanted to tell you this story to point out a few things. Number one, medicine that your parents talk about or your grandparents talk about, or even that was what it was like 15 or 20 years ago, is very different from what it looks like today. So make sure you know what you're really getting yourself into, because the business of medicine is something they don't teach you about in medical school, but it's the hardest part of medicine. It's, where does the money come from? How are you making the money? And whether that money is going to be in conflict with what you're trained to do. Secondly, I want to point out to you that I made a whole bunch of different changes in my career throughout my career. And a lot of people at different times thought it was not a good idea, right? When people are like, why would you go to New Jersey for residency when you could have gotten into Cornell residency? But it turned out to be a better choice for me because it was where I wanted to be, and I got the job that I wanted when I finished residency. Why would you leave your Princeton office job to go do work in Trenton? But again, it turned out to be the right decision for me. So, believe in, if you feel called to do something different, believe in that and don't worry about what the naysayers tell you. Okay, so let's see, where are we? And in the end, because I followed what I believe is right for myself and didn't worry about comparing to what other people are doing, I feel like I ended up in the right place in my life, that I'm very happy right now. Okay, so let's see, what are the misconceptions that I wrote on this slide? Oh yes, okay, so don't think that, hey, I'm going to become a doctor, I'm just going to be rich, I'll have nothing to worry about for the rest of my life. Student loans are a major thing. I mean, people my age are still paying off their student loans. So it's expensive, this medical education. And depending on what specialty you go to, you're not necessarily going to be making more money than your friends who are at their corporate jobs doing whatever, so that is not a reason to go into this field. I think being a doctor, yes, it takes a lot of hard work, and you have to really want it because it's hard these days. It's hard on multiple levels, and especially now during the pandemic. I do think, most doctors that I know do not think that they're God. Most doctors that I know are very, very caring people. And I think almost to a fault, because a lot of us do take our emotions and experiences home with us, and it causes us stress. So that's something you're going to have to learn. If you are like me and very emotionally sensitive, you're going to have to learn to make those boundaries and leave work where work belongs. Yes, and we do get very attached to our patients, and I have had a lot of career in geriatrics. So you also have to help your patients with end of life stuff, and that can be hard to get used to when your patients pass, and you ask yourself, is there anything else I could have done? But in the end, that's a lot of that is not in your control, so you have to accept that. More and more doctors these days are having side gigs. more and more doctors these days are cutting down to part-time and doing side things either for supplemental income or just for some, more joy in life. So, to make sure that the things that you're passionate about, you don't necessarily leave behind because your career takes over, that those things all keep your life fun and worthwhile. Okay. Now, do you want to are we leaving questions for the very end?
Yeah, the Q&A session is after.
Okay, perfect. So I'm going to go through a couple cases with you guys, and I hope it's educational for you. All right, we can go to the next slide. All right, so these are real cases that I've seen in my clinic in the past several months. And the theme here is going to be weight loss. Okay, so this is a 38-year-old male who came to me saying that he had lost 10 pounds in the past 3 months. Okay, so right away, when you hear about a significant weight loss, which is unintentional, by the way, of course, you always ask them, hey, like, have you made a major change in your diet? Have you, been increasing your exercise? But this, his lifestyle was the same. So there are different categories that you want to think about, and some are more worrisome than others. Okay, so I think the most worrisome category that we think about when we hear about significant weight loss is cancer. Especially cancer of the gut, cancer of the lung, lymphoma, renal cell, prostate. Those are all possible things that you want to think about. Also, of course, the gastrointestinal tract, right? So if you're not absorbing things in your gut, that might be a reason why you're having weight loss. You want to ask them about, how their bowel movements have been. You might have heard some people have a gluten intolerance, but some people have a real gluten allergy called celiac disease. That could be, a form of malabsorption that can cause weight loss, as well as inflammatory bowel disease. There are some hormonal endocrine related issues that can cause weight loss, including if your thyroid is overactive, if you have diabetes, or if you have adrenal issues. Of course, we know that some types of infections can cause weight loss as well, like HIV, hepatitis C, tuberculosis. And then, you also want to rule out psychiatric causes, right? Psychiatric causes such as an eating disorder, depression, anxiety, causing them to have no desire to eat. And even neurological issues as well, such as Alzheimer's. Sometimes, especially when you have a patient with Alzheimer's who's living alone, they might be forgetting to eat and their family might not be aware of that. So that's something to keep in mind as well. So this patient gave me some clues upon the first visit, which was that he felt more thirsty and was going to urinate more frequently. And I did routine blood testing on him. And what I expected to find is what I found, which is that his sugar level was high and he had diabetes. There is a number called Hemoglobin A1c, which tells me the average sugar over the past 3 months, and normal is 5.6 or less. If that number is 6.5 or higher, that is considered diabetes. His number was 14.6. So incredibly, incredibly high. Okay. So how does this work? Is that the patient had a lot of sugar in the blood and a lot of sugar in the urine. So that the sugar in the urine causes increased frequency of urination through the osmotic pressure, right? And patient might also be very thirsty because they're losing a lot of fluid. He may also feel fatigue because the sugar, instead of going into the blood cells and giving the cells energy, is actually just staying out in the bloodstream and not helping the cells at all. Okay, so luckily, this can be treated with medications, which we did, and we got his sugars under control. Okay. All right, let's go on to the next case. Oh, wow. Oh, I did write this all out. Okay, I didn't know these slides are here. Let's see. Forgetting to eat. I think I reviewed all of these already. Yeah. Oh, yes. And a good thing to note, a goal when you have a patient with diabetes, I told you 5.6 or less is the normal for hemoglobin A1c. When that A1c is 6.5 or higher, it's considered diabetes. But when you have a known patient with diabetes, your target for treating them is to keep the A1c less than 7. That's a generally good thing. If you treat them, if you try to keep it lower, oftentimes they'll have low sugars, which is also not a good thing. They might get sweats and dizziness and maybe even pass out if it's too low. So you don't want that to happen. Okay. Yes, when the sugar is this high, they need insulin to get it under control. We have to teach them how to inject themselves, but that also makes them very motivated to change their lifestyle. And sometimes when they really improve their diet with decreased sugars and also decreased carbs, exercise, lose weight. And this is, by the way, type 2 diabetes. Okay, I'm talking about type 1 is a whole different story, mostly diagnosed in younger patients before they even end up seeing me. So I'm rarely diagnosing type 1 diabetes. I am very often diagnosing type 2 diabetes. Okay, so type 2 diabetes is one that it definitely can be changed by lifestyle with healthy diet, regular exercise, weight loss. And sometimes they're motivated enough that you can actually transition them to be well controlled on pills if they get those other factors under control. Patient also had a high cholesterol, and it was important to put the patient on cholesterol medicines because both diabetes and high cholesterol are risk factors for heart disease. And most patients with diabetes should be put on a medicine that works at the level of the kidneys to help protect the kidneys against damage from sugar, which is a very common thing that happens. Okay, very good. Let's move on to the next slide. Okay, so this is, yes. So this was a different situation. A 61-year-old female, she had a 55-pound weight loss in the past 6 months. That's a lot, right? So in October of 2019, she weighed 170 pounds. And in April of the following year, she weighed 115 pounds, like huge difference. Her brother had passed away 1 month ago, and she said she had been on a medicine for depression for many years. So, you know, was that a factor? Possibly. And that was what was in my mind. She had also had constipation for the past 2 months, associated with rectal bleeding and hemorrhoids, and pelvic pain for the past 6 months. Okay, so in somebody this age especially, I think about cancer. The 38-year-olds, yes, some cancer is possible, but in a person who's 61, much more likely to be cancer, okay? She did have diabetes, but it was well controlled. Her A1c was 6.6, which is right where we want it to be, as I told you the last time. We checked her thyroid level, and that was normal too. Her urine test was normal. No, sorry, her urine test initially, she did have a urine infection, but we did treat it, and it was not a cause of her weight loss. So in anyone over the age of 50, especially number one, anyone over the age of 50, and now some experts are recommending 45 and up, should have a colonoscopy for screening for colon cancer. Now, this patient has even more reasons to get it, not just because of their age, but they had a change in bowel movements, they had rectal bleeding. So colonoscopy is very important. That's when they have a camera, they put it up your bottom, and they look all throughout the colon. Okay. So I definitely ordered that. Because of the pelvic pain, and there was persistent blood in the urine. Yes, I forgot to mention. So even though we had treated her urine infection, there was still blood in the urine, and it can be a sign of infection. But once the infection was gone, the blood was still there. Now, this patient is 61. She's no longer having her period, so that's not the cause. So it is concerning that there was blood in her urine. So I ordered a ultrasound of the kidneys and bladder to see like what along that tract might be causing this blood. So we actually were waiting for that scan to come through. And another issue you'll see is that you have to wait for insurance to approve a bunch of things sometimes before we can get it done. So we were waiting for her insurance to approve her ultrasound. But before we were able to do that in May, she ended up going to the emergency room because she had severe left flank pain. So that's like the lower back on the left side. And the CAT scan showed a large mass in her kidney. It was 11 by 8 by 11 centimeters. And we ended up doing a biopsy, which showed renal cell cancer. This is a tough case for me because every time I see this patient, she's like, "Oh, Dr. Tang, thank you so much for diagnosing that for me. And she says that I saved her life, right, by diagnosing it for her. But the truth is that she went for chemo and it didn't work. And she is going for another type of treatment now, but it's more experimental. She's having a lot of side effects from it. And so this is the tough part of medicine that really pulls at your heartstrings, where she's so grateful to me that I diagnosed her, but in the end, I don't know if it's going to make a difference. It's not easy, but she's a wonderful person. And, I right now I'm focusing on trying to make her as comfortable as possible while she's going through these difficult treatments. So, yeah. All right. And I think that's it, right, for our slides? Okay, great. Let's make sure I already touched on these things. Advice: make sure your medical interest is coming from you and not your parents or other things. I think you guys know that, right? Yeah, volunteering. I love volunteering, because I think that if you want to really be motivated in your career as a doctor, you really do have to have that love of helping others. And I think volunteering is a great way to manifest that and see if it's right for you. Get set up with a mentor for shadowing. Yes, that's what you're doing now. And I think, if you know someone who is actually in clinic or in the hospital, don't be afraid to just ask them, "Hey, can I just follow you around for a day and see what it's like to be you?" It will help you a lot to decide whether or not this is right for you. Do the things that you love. Yes, showcase who you are as a person. Be a well-rounded person. Don't just do things to put them on your application. Present. Yeah, be you. This is what I found throughout my career. Be true to who you are, and you will end up in the right place, because the people who are looking for someone like you are going to grab you. The people who are not looking for someone like you, if you go to work with them, it's probably not going to work out anyway, All right, very good. I think that's the last slide. Yes. Okay, so let's open it up to questions.
So for anyone who has any questions, you could unmute now to ask Dr. Tang, or you could type it in chat and I'll read them out to her. But it's a Q&A session now.
Okay, let's see. I'm gonna go down to that chat and see how often, hi Sally, how often do patients surprise you, or how frequently do you come across something you're unfamiliar with? Patients surprise me every day in what they complain about, in their reactions to certain things, and all. It's never boring. That's one thing for sure. Medicine is very unlikely to be boring. Um, yes. How often do I come across something I'm unfamiliar with? Well, I think whatever career you go into, there are some things that are going to be typical, like you see all the time. Okay. So the things that I see all the time are diabetes, high blood pressure, high cholesterol, like that first patient that I presented to you. Those are really just common things that adults live with and have to deal with. But yeah, okay, I mean, part of it is your own experience. I've been in practice now for 17 years. But yeah, occasionally you still see something that you're unfamiliar with, and that's okay. So the nice thing is we have resources. Up to Date is a great resource where I love to look up things. That's a medical resource, and that's also why we have specialists, right? So I'm as a primary care doctor, I have to have a wide breadth of knowledge, and I can deal with most like common things that I see in adult issues. But when it gets more in-depth and it's something I'm not familiar with, that's when I would refer to a specialist. So I think the nice thing is that there's tons of resources, and you don't have to know it all. It's okay. It's totally okay to like look it up somewhere, or ask a colleague who has more expertise in that area. And now with the advent of social media, which we totally didn't have when I first started training, you have an even like greater network of people. I'm going to age myself by saying Facebook, because I know you guys are probably too young to be on Facebook, but I'm on a ton of Facebook doctor groups where sometimes we just say, hey, like I saw a case of this, and that today. Has anyone seen something like this or have any insight for me? So we do that all the time with our colleagues. And it's just really nice to know, like, I mean, you're just a human person. You're not ever going to know everything, and that's okay. Okay, let me see. I'm just trying to scroll here. Rofina, hello. Let's see. What do you think the biggest problems will be for the next generation of doctors? Oh, you're welcome, Sally. In terms of technological advancements in medical school applications becoming more competitive for students. Medical school applications becoming more competitive for students. So, I have to say I'm not as familiar with what it's like to apply to med school these days. And I'm not as familiar with the process because I don't know anyone who's gone through it recently. So that is hard for me to answer. And, maybe you could go speak to somebody who graduated more recently than I did. But in terms of the problem for the next generation of doctors, I definitely think there's going to be a battle between the healthcare system, the business of medicine side of it, and doctors. And I don't know how it's going to end. You have big hospital systems that are focused on making money. You have insurance companies that are focused on keeping costs down. And then you have you have lawyers who, any mistake you make, they're going to jump on it and you'll get a malpractice suit. So you feel like there are many, many components working against you, and you're just here trying to do the best you can for your patient. So there's a lot of stressors coming from all different directions. And now I think specifically to the next generation of doctors, we also have the internet and social media. And that's been very disheartening in this season of COVID, where you have people accusing you of being some part of a giant conspiracy, of lying, of, not trusting their doctors. There's more and more patients looking online for their answers rather than trusting their doctor. who has all this training, and some Joe Schmo can just come and say something, and you have no idea what their background is, but if they sound confident enough, a lot of people follow them. So that is also a huge challenge in my world, where I need to re-educate people and sort of say, hey, I know you heard that and that's your understanding, but that's actually not medically true, and let me try to explain to you what is. I hope that was helpful. I wish I could speak more about what the application process is like now, but I don't know. I'm sorry. Okay. Hi, Aisha. What do you do if you do not know something or how to treat a patient? Might be hard. It's rare that I don't know where to start about treating a patient. Right, because either I can say, wow, this sounds like it's above my level. I think you need a specialist. This is a job for a specialist. I will refer you. Or I'm not sure what's going on with you right now, but let's get a set of, blood work and maybe some radiology studies to help figure it out better. In the rare instance that I'm like really completely clueless, I'll be like, oh, excuse me for a second, and look it up on one of our medical resources that we actually have on our computer. But I think that happens much more when you first come out of training, and then by the time you're more experienced, you sort of have an idea of what direction to go in. And like I said, we have tons of resources at our fingertips now with the computer and the internet. So please don't ever feel like you have to know everything. None of us do. Oh, thanks, Rafina. I'm glad that was helpful to you. Oh, yes. And then Aisha, I just was looking back at on top of medical, the thing is that there's advancements, there's discoveries in medicine at such a huge pace now compared to when I started training in medicine, right? So, I mean, even just with COVID, the rate at which we're learning about and try to change our recommendations about COVID, there's lots of opportunities for what's called CME, continuing medical education. And I usually will attend a conference at least once a year to get an update on the most important things that I need to know. I subscribe to, journals as well, which is a way to keep up to date with the new medical advancements. But yes, it's hard, and you're never going to know everything. You just sort of have to keep up with, just like what I said at my undergrad, Cornell undergrad experience. You have to kind of prioritize what are the things that are most relevant to you in your practice. Okay, so I don't know if there's like one more question I could probably do, but then I have to hop off. So I'll just wait a minute to see if we have one more.
Yeah, we can do one last question before we do the ending.
Okay, great. You're welcome, Kanza. Thank you so much. I hope it was helpful. And, feel free to, you know what, I'm put my email address here. You guys can all feel free to email me if you have any further questions, or if you're ever in the Los Angeles area and want to come follow me in clinic, you're always welcome to. And I want to know which one of your parents knows me, because I lived in West Windsor for 10 years. So I think it's not totally random that I connected to Shadow Bunny on Instagram. I just don't know. I'm sure I'm friends with one of your parents. Oh, Sally, great question. What did you wish you knew before starting your medical journey? I wish, I wish I knew that I would be able to create my own path that wasn't necessarily the traditional path, but it worked for me. And I'm hoping the message that you got from me today, because I think a lot of environmental factors are going to say, hey, you're on this path. This is what you do next. This is what you do next. This is what you do next. But if it's not right for you, you can make your own path.
Okay, so that'll be our last question for today, but I just wanted to thank everyone who attended for showing up to today's webinar, and a special thank you to Dr. Tang for her presentation and for being a great speaker. If you could, I would appreciate if you could stand back a couple minutes after the webinar so we could have a chat with you. But as for students, just a reminder that you will have to take a quiz on this information. Like I said before, it is a super low stress and simple quiz. So as long as you're paying attention, you should be fine. And this meeting has also been recorded. I will actually stop the recording now.